Are you pregnant and have concerns or questions about your nutrition and how it affects you and your baby? Today, we're continuing our conversation from last week with Katie, who is a registered dietitian who specializes in postpartum nutrition and prenatal health.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
One of the things I wanted to start thinking about and would love to hear your opinion about is like, when should we be considering recommending, what's the optimal time for us as providers to think about when we should be getting our patients in to see a registered dietitian, especially pregnant women? Like, should that be, if it's planning, should it be, when they're in the planning phase? Should it be specifically in the third trimester? Like, when do you think is an optimal time for us to really think about how we can best support mommies by getting them in to see someone like you?
I would say, of course, everybody should see a dietitian because there's always something to be gained. However, there are definitely certain scenarios where you really want to make sure that you're getting that hand-holding and support throughout the preconception, pregnancy, and postpartum time. For example, if preconceptually you have a history of hypertension or diabetes, those are two scenarios where I would see a dietitian prior to pregnancy and going throughout your pregnancy and postpartum, because that innately is you will have to manage your blood sugars throughout pregnancy, and you will be closely monitoring your blood pressure so that it doesn't become a further complication for both you and baby down the road. So those are two scenarios preconceptually, if we're kind of taking out hormone infertility, that kind of stuff out of the picture. And then, and then preconceptually also, if you have a history of PCOS or any thyroid condition, those are also two scenarios where I would get support from a dietitian, because also the stress management component, the blood sugar balance, nutrient needs, those are all very important with those types of conditions preconceptually leading into pregnancy and postpartum. And then if you are pregnant and you're like, oh no, I was not expecting these symptoms. So if you're having any nausea, vomiting, intense fatigue, even if it's mild fatigue, any fatigue is valid, and headaches or more frequent migraines, constipation, those are all scenarios where we can optimize, figuring out maybe we need to incorporate different types of fibers or optimize on supplementation, or just get some strategies in place on how to increase protein during those early days, so then blood sugars are more balanced, and that could reduce the nausea. You're getting enough B6 and magnesium, potassium, all those great nutrients. So those types of issues I would address early on. And then maybe you're in the middle of your pregnancy, things are smooth sailing, you're feeling good, and you come up to 24 to 28 weeks and you are gnawing at the bit for that glucose test or your gestational diabetes screening, and you are just so unbelievably nervous about the outcomes of that. So first things first, I always like to tell everybody the 1 hour test is just a screening. It's not diagnostic. So that will just lead you into if you need to take a 3-hour glucose test or not. But sometimes it's helpful to have that reassurance of like, how am I eating currently? Just to make sure that you are prepped and ready to go for that glucose test. Also, like having the proper snacks after that glucose test. I don't know about you, Dr. Blair, but I felt like my blood sugars plummeted after that test. And at the time I was living in Jersey City and my OB was in Manhattan, and I actually had to like sit down and take a break and like eat my beef jerky stick and take a minute, because you never know how you're going to react to the test like a couple hours later. So having that strategy in place. So you can get through mid-pregnancy, and then you are in your third trimester, you're starting to think about how to eat for postpartum. we can do that type of prep and planning. But also, if you have risk factors, again, for gestational diabetes, or you're experiencing hyperemesis gravidas, also known as HD, where it's like water is making you vomit, or just looking at anything, you can't keep anything down. So that's another time it would be really important to not only be seeing your doctor and getting IV hydration and all that kind of stuff, but seeing a dietitian to see if there are other ways that you can get nutrition. And then also for that gestational hypertension, preeclampsia, I think I mentioned that. Also, if you are a twin pregnancy or multiples pregnancy, ooh, that is a crucial time to be seeing a dietitian. I have a client that I'm working with right now, and she is such a trooper, but innately with twin pregnancies, one, your blood sugars tend to run higher just innately during a twin pregnancy. So that creates a lot of anxiety of nervousness for gestational diabetes.
Yeah.
But also like iron needs are like so much higher during a twin pregnancy. And we may get into this in a little bit, but inadequate iron can also lead to preterm delivery and different complications. So we really want to catch those labs and risk factors sooner than later during pregnancy.
Yeah, I mean, I'm still with you. I think everybody who's pregnant should probably see a registered dietitian at just the beginning and probably throughout their pregnancy, because it's just kind of like a vulnerable time. And because I think usually physicians are pretty good at catching those who are at the extremes, right? When they're not keeping food down and they have gestational diabetes, they have gestational hypertension. We're like, yeah, I got this. You need to see a registered dietitian. But who gets missed or sometimes the moms who think it's normal, or it might be normal, right? Like it is a little bit normal to not have your quite, maybe have preference for foods, or feel like some things make you feel queasy and you're not as hungry as you were. Or fatigue is a great one. Like every mom who's pregnant is like, well, I'm just really tired because I'm pregnant. And yes, pregnancy is exhausting, especially if you have other kids. But that doesn't mean that we shouldn't, that there isn't something else that we could be to help maybe taking care of. And it's such a subjective thing. Like, how fatigued are you? Is it fatigued enough where I should be checking an iron and looking at your vitamin D? I think like better for my end, and I'm not an OB, but from a pediatric standpoint, I always tell parents, like a blood draw is very little risk, and the benefit and the risk of missing something is bad, and the benefit is potentially really good. So when there's very little risk and there's the potential for benefit, we should be doing these things.
Right. 100%. And a lot of the times the answer is for like not drawing the labs is like, it may not be covered under insurance, but I can tell you it would probably be like another $10 to pay for a vitamin D lab.
As long as you're not ordering, some
crazy,
very
like
specialized esoteric vitamin D lab. If it's a standard 25D, vitamin D, it's not really expensive. And then when those are the concerns, I tell patients, call a LabCorp. They will tell you, they're by law, they have to tell you what a bill estimate is going to be for this if it's not covered. And then I think as physicians, just keeping that mindful, making sure we have other plans. Like sometimes we can run it with a smaller private lab that has better pay out-of-pocket fee rates. But that doesn't mean we shouldn't check them. And glucose, we have no excuse, because that's like the easiest thing to check ever. And we can find workarounds, like, although you should not be, you can have an iron deficiency and not be anemic. You can have non-anemic vitamin iron deficiency, sorry.
Yes.
If like it's really going to bind, we can at least check a hemoglobin in the office and make sure that you're not so iron deficient that you're anemic. So I think, there's always workarounds to those things, but I agree with you. I mean, typical out-of-pocket expense for standard labs is not a lot. It's only when we really get into like very specialized orders that they can get a lot, and we can always get an estimate ahead of time if that's the case.
Exactly. And one more thought is if somebody is planning to have close pregnancy spacing, so if somebody wants to have another child before like 18 to 24 months from the previous pregnancy, that's also a really good time to see a dietitian, because you're coming out of that first year of life is just like survival mode. So you really want to make sure you're giving both you and this future child great opportunities by being well nourished. So if you feel like at 12 months postpartum that you might want to be trying again to really at 6 months start seeing a dietitian to really make sure everything is up to snuff.
I didn't really think about that, but now I'm thinking about it more. I'm like, because a lot of my mothers that I see who are having, 2 under 2, maybe still breastfeeding the first baby. So that's like also a consideration, I think, trying to get potentially, because you can get pregnant while you're breastfeeding.
Right.
Think about the nutritional needs from both of those ends. And then the twin gestations, like if you're going to be trying to breastfeed your twins, definitely you need to have a nutritionist involved because your nutritional needs just go like sky rocket.
Yeah.
And I guess that kind of leads me to the questions. Like, I feel a lot of the time, because moms are mostly seeing me postpartum, like you said, you kind of get that 4 to 6 week checkup with your OB, but you're seeing your pediatrician a lot. I often get questions from moms about, I think, postpartum and pregnancy nutrition. And are there myths out there that you hear providers telling your patients where you're like, that's not really true? And I wish maybe we didn't say that.
Yes, definitely. So I bite my tongue a lot and then put out good, hopefully,
good educational
good and
content.
useful content because, you also want to be respectful. So when it comes to food safety, there are a ton of myths out there, and I can understand why providers can make these generalizations because they are treating a wide variety of individuals with different backgrounds and different accessibilities. So I can understand it's safer to make a little bit of a more general statement about certain foods than it is to talk about the nuances and the caveats, because when it comes to food safety during pregnancy, it isn't black and white. It is very gray. But I will say with a lot of these food outbreaks lately, I have been erring on the side of caution with a lot of my recommendations.
I'm like, boar's head, just like kill it.
Yeah, exactly. But I do say to clients, like, it's boar's head. Like, let's not talk about, like, it's not other varieties. Like Whole Foods, they do a roasted turkey that's like literally like fresh roasted turkey that
and
they
then slice.
Yeah, exactly. So that's where we're in the gray area. So when it comes to food safety, like talking about your cheeses, like raw milk is the latest and greatest craze. And it's not to say you can't have it, but it's to say you need to be very vigilant and very cautious with who you are buying from and really knowing the ins and outs of their manufacturing and processing systems, because it's not necessarily the food itself that's dangerous. It's how it's being processed and held. It could be held at a dangerous temperature that creates that environment for that foodborne illness, that salmonella, listeria, campylobacter, E. coli, all those types of contaminants. So it's not, so when it comes to your dairy, it's best if it's pasteurized, and you can have the soft cheeses. You can have the gorgonzola. You can have the blue cheese. You can have your burrata. Just make sure it's pasteurized. And when you go out to a restaurant, you can ask all the questions you want. It's your right. And, nobody wants that liability of
unpasteurized products.
Exactly. So the time when you should toss the cheese is when the mold is unintentional. So you open up your brick of cheddar cheese and you see this blue sprouting thing. That mold is unintentional, and you should throw that cheese out. And you shouldn't cut around that mold because it innervates throughout the block of cheese, even if you can't see it. So that's one myth, is that you can't have your soft cheeses. In terms of fish, who's to say that you can't have more than 12 ounces a week or 2 to 3 servings? We want to be very cautious about the mercury content of that fish. So a good rule of thumb to go by is the smaller the fish, the lower in mercury it would contain. And the bigger the fish, the higher the mercury it would contain. So you can have salmon, you can have cod, sardines, flounder. We also want to do wild caught as much as possible, or know that the environment in which the farm raised fish is being produced is optimal, because there are new farm raised fish hatcheries that are very innovative in their approach. So it's not to say we can't do that. It's just, again, you need to know the ins and outs, which is very time consuming. And then as far as sushi, it's not that you can't have sushi. You can have a cooked sushi roll, like a shrimp tempura or a sweet potato or a vegetable roll. It's again how it's being handled. So you can ask the restaurant can you use a clean surface, a new knife, new gloves? Can you get fresh rice to roll the roll in? And then there you go, you got your sushi. And if you are out on the seacoast and somebody's bringing in a freshly caught piece of fish, there's no reason, and it's also, again, being handled properly and kept at the proper temperatures. There's no reason why you couldn't enjoy that raw fish, but it has to have all these caveats to go along with it. So hence why it's easier to say just avoid sushi. But I mean, go to Japan, pregnant women are having sushi all the time.
Yeah, I mean, I think it's again, it speaks to like maybe taking the time to explain to patients and letting them decide what is important to them. Like if they want to go through these steps to make sure, or if they want to go out and buy fish fresh from, drive down to the Jersey Shore and get their flounder and bring it back and do whatever they're going to do with it. Mm-hmm. I think it's not on us as providers to just make that statement for them, just decide like, this is too much for you to jump all through all these hoops to make sure your food is safe. Just don't eat it. It would be better, I think, to just explain these are the things that we're concerned about. Look for these things. If you really want this, or this food is really important to you and your family and your ability to eat it and enjoy yourself. Just like jelly meats. I mean, that's the one I get a question about all the time. I'm like, listen, if you roasted a turkey and slice it up and you put it right in the fridge, like there is no reason that you can't have a turkey sandwich. There are definitely, I think, locally, there are stores that use less preservatives, that have a more transparent process that I'm happy to share with parents. Yeah. Like if you're willing to drive up there and get it, like I don't see a reason why you can't have your deli sandwich if that's what you're really craving and you're going to enjoy it. And that's like happy for, something for you. And I say like, look out for these things. These are the things you're looking out for. And this is why we're concerned about it. But I think in general, the more foods we can allow pregnant women to eat, the better. Same postpartum. Like I get a lot of questions about things in mommy's diets affecting baby, like their gas levels or their ability to breastfeed or their desire to breastfeed.
Right.
And the truth is or eczema is another really popular hot topic. And I'm just like, well, we have to balance the risks. Let's not even talk about the science of whether they're valid or not. Let's talk about the risks and benefits. What are the risks of eliminating all of these things from your maternal diet? There's lots of micronutrients and things like eggs, soy, etc. These have a lot of micronutrient benefits to you. How are you going to get them if we eliminate all of them, first of all? Second of all, what's going to be the impact to your quality of life and your mental health if we do this? And third, what is the potential of benefit, if any, to your baby? Those are the kinds of conversations I think we have to have, instead of just saying like, no, that's like, just don't do that.
Right, exactly. Oh my goodness, yes, because like cheese and yogurt postpartum, those are saving graces for a lot of people because they're quick and easy. And so if you say like, oh, there goes your snack, and then they're just not eating anymore, like
I know we're debunking myths. I think the food safety is a great one. Are there any other kind of myths out there that you really think are important for mommies to be aware of?
Yeah, so quickly, first and foremost, if you have a diagnosis of gestational diabetes, know that it's never your fault. There's a lot of risk factors that go into being susceptible to gestational diabetes. Being over the age of 25 is number one, is a risk factor. So like a lot of people are not even thinking about kids at that point. So just know that that's never your fault. And with strategy and a team, you can manage this diagnosis seamlessly with hopefully no complications no complications. And then finally, not all prenatal vitamins are created equally. Even if it has an NSF label on it saying that it has good manufacturing testing, third-party testing on it, doesn't mean that the prenatal itself has therapeutic doses of all the micronutrients in it. So a lot of them are missing adequate vitamin D in it, or vitamin A in the active form retinol palmitate. So just to give examples, or enough selenium, iodine, those are, or choline, for example. Those are all really important micronutrients that can easily be missed in a prenatal because they're either trying to reduce capsule burden or it just doesn't have it. So those are two myths that gestational diabetes is not your fault. And because it is certified, third-party tested, or has like a doctor's stamp of approval on the label, doesn't mean that it is at a therapeutic dose.
Yeah, it's interesting. A lot of them don't have selenium, I've noticed.
Yeah. Or enough iodine, too.
I'm like, a lot of them don't have iodine or very little amounts at all. Are there specific ones that you kind of like, or do you use like a combination of your patients? Because I feel like a lot of the time patients, when they're coming to me, are on multiple things to try to get everything that they need.
So depending on your pill tolerance and where you are in your pregnancy, there are different prenatals where you could take it in powder form, or you can even open up your capsules into like a smoothie or yogurt or oatmeal. So that makes the pill burden a little bit less. But I do absolutely love this brand called Fullwell. That was created and founded by a fertility prenatal dietitian herself. And then another one that's fairly comparable to that is Needed. And those are two that I typically recommend. However, neither contain iron. So, which I am okay with, because I rather dose iron based off of labs and based off of somebody's needs, rather than blanketly giving them a certain amount of iron, because you also have to be a little bit strategic in the form of iron and how often you give it, because there is a hormone called hepcidin that you don't want to activate. And if you're taking iron every single day, that could activate
every other day.
Yeah, exactly.
There's pretty good evidence to support. I don't know that a lot of pediatricians are aware of it, but since we also deal with iron deficiency as pediatricians, there is pretty good evidence for dosing your iron every other day for better absorption, so you're not affecting hepcidin, which reduces the absorption of iron. So and it's better tolerated for kids because they don't like the taste of it. It makes them constipated. So every other day is kind of better for everybody.
Yeah, exactly. So
cool. Well, thank you so much for all of this amazing information. I really hope that the mommies out there find this episode to be empowering and hopefully makes them excited and not stressed out, and that there's lots of things that they can do for themselves, and that reminds them that they should be taking the time, I think, for themselves to think about their health as the number one thing they can really do to help their babies.
Exactly. I hope so too.
Thanks so much.
Thank you.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.